The patient we're looking at, the 74-year-old lady who presents with myeloma, could she be a candidate for the Acylon combination with Daratumumab, melphalan prednisone with bortezomib? She could. She would fit the criteria if we think of her as a non-transplant candidate. Are there other options she could benefit from? There certainly are. I mentioned before that the use of a proteasome inhibitor and steroids, such as bortezomib and dexamethasone, is recommended by international guidelines. And I also mentioned that the added use of cyclophosphamide or Cytoxan to that combination is also endorsed by international guidelines. The Acylon using melphalan and prednisone would be the equivalent of Cytoxan and dexamethasone. You have the alkylator and the steroid. And then you have bortezomib in Acylon, which is exactly what the international guidelines have. Acylon also in the experimental arm had the added benefit from daratumumab. So I think for a patient who is looking for a non-transplant designed regimen that it could be used, I think it's probably less commonly used in the United States because of traditions, and there are a lot of other drugs. So I think a lot of American doctors probably would use Cyborg. They would use bortezomib with Cytoxan and dexamethasone. While in Europe and in other parts of the world, in Asia, maybe the Acylon combination would be more frequently used. That being said, it would be possible to use this combination here in the United States as well. What are the practical implications with the Acylon combination with bortezomib, melphalan and prednisone, and daratumumab? It is a pretty straightforward regimen. Bortezomib has been used for many years. It was initially FDA approved in 2003. The clinical important pieces is that bortezomib should be given subcutaneously and not intravenously to avoid peripheral neuropathy. Melphalan and prednisone are oral drugs, so there is really not a whole lot to consider there. I think offering patients omeprazole to alleviate the irritation in the stomach from steroid probably is something to consider. And talking of drugs to support and prevent prophylactic strategies, if you give bortezomib, you also need to think about herpes zoster prophylaxis. You need to do Valtrex therapy for that. When it comes to the daratumumab drug, that's the new drug, obviously, in this combination. Doctors need to think about type and screen before the drug is given, because the drug interferes with testing that's done at the blood bank. If you didn't do that and you send the sample for type and screen, you would get signals that the patient has DAT positive or Coombs positive tests. You need to notify the blood bank about that. You also need to give pre-medication for daratumumab per the label. Other than that, I think it's pretty straightforward. Daratumumab is given the same way as the FDA label for single drug, as well as in combination with other drugs, meaning that you give the daratumumab drug once a week for 8 weekly doses, and then it's every other week for 8 weekly doses, and eventually it turns into every 4-week dosing.